increasing on the daily basis in Liberia. We do have some doctors who are trained with some equipment, but then at one stage of the cancer treatment, they will refer you to another hospital. A sister of mine, who was my chief administrative officer in my office when I was in the House of Representatives, and this year she started her cancer treatment at the hospital, and she passed. While she was doing the treatment, she was referred to India. Unfortunately, it was late. When she came back, she passed away. You get me? There are a series of cases of heart diseases for children. The last time I went to a program where one of the doctors called Dr. Hart had a program at Moria's City Hall trying to raise resources to support those little children. I think they have about 12 cases that they found that went at the hospital below the ages of 5 to 2 years. Out of 12, now you have only 4 of them living. Those other ones living, the 4, they are only waiting to die. And there are major cases. Go to hospitals, go into the communities. People are sitting home, they have given up because doctors say we are unable to treat this person. The only solution is you have to take them outside of Liberia. Some of these individuals that have those cases or their relative, unfortunately, what happened? They are unable to provide even their daily meal before you're talking about hospital. So as such, as the government, is the constitutional right of those citizens that government must cater to them. So I've appealed to my colleagues today, asking them to set up a special needs funds in the national budget, where people go on a radio station crying for help, people at the hospital waiting. If you go now at the eye hospital, there's a little boy there who is about 2 years old. One of his eyes gone already from cancer. I received a call from the mother and she said, "Oh, I'm about to lose my son." Do you know what it means for somebody to just sit there and thinking that the son will not live? Setting up a special need funds where the Ministry of Health can serve as the custodian of that special need funds. Set up a special department at the Ministry of Health where they can pay those bills of those special need cases. Not just that, focusing on one of the hospitals, see if they can equip their hospitals to empower specialized doctors where they can work there and help those cases. These are our citizens. If we don't help them, what's going to happen? They're going to die. You understand? And I think I consider this as emergency because as we speak, if you want to find a time, you walk along with me to those hospitals, go and see for yourself what I'm talking about. Any of these people could be your relative and my relative.
So, sir.
But some of them are, in fact, home. Setting up a special needs funds that provide those urgent needs. These are emergency funds to help our citizens. It will help us. Yes.
Now, talking about the emergency needs fund, what I gather from you is that you you intend to have it in two categories. One, to address the issue of emergency SOS calls around the country.
Health-wise.
Health issues.
Yeah.
And also to equip maybe a single health facility in the country that will attend to those issues through specialized doctors. But how soon are you expecting to see this? That's going to take a very long time, and the number of SOS cases, especially for health-related issues, are increasing. How soon? And how do you intend to address the issue that has to do with maybe people just knowing that there's an emergency fund and then fabricating something just to fit in?
Well, first of all, no one can fabricate a signal that is between life and death, because doctors have the capability to diagnose your crisis, your case. So what I'm talking about is hospitals are the ones that are going to make decisions. Doctors that are going to refer you to special needs funds. That is, they have proven that you are unable to cater to yourself. We don't have insurance that cover all of our citizens, or there's no program that cover our citizens. You understand? But yes, I agree with you. There are two categories that we need to focus on. To equip a hospital, it's not going to take you more than a month. Let me just say this. What you need is money. You can, in terms of equipment, to equip one hospital to make sure that they have all of the equipment and specialties to make sure that they can do the job in bringing in individuals to help. I think approximately up to 5 million can do that. You understand? Now, in the meantime, getting additional $5 million to be able to send those cases out that can be treated out, that is for now, to start helping us. So I'm going to be pushing my colleagues for the government people, and these are our citizens. We have to work in their interest. So I'm requesting for $10 million as a special needs funds to empower medical doctors, equip one major hospital, and also use another $5 million to facilitate our citizens in making sure travel expensive, cost of the surgeries that they will be doing, feeding, whatever, that will be able to help. I think we need to focus on making sure that our citizens feel the impact of the budget positively, directly.
Well, Senator, maybe apparently you have spoken about it. My name is Yamti Topa. I work for OKFM. Well, basically, the issue about this fund that you're talking about, if approved by the legislature as a whole, which institution cater to this fund, and how do people access what you're talking about? Well,
the health committee have been asked to look at the method going to be used around those funds, if approved. But I think it should be the Ministry of Health, because the Ministry of Health is responsible for all health matters in a country. The Ministry of Health have also the capacity to work with partners. I'm not just going to discuss this at the Capitol here. This next thing, as senator of this country, I'm going to be inviting all international organizations that are implementing health program in the Republic of Liberia to sit, and then we can have the conversation. You understand? Let the Ministry of Health receive additional $10 million, use $5 million to fully equip a specialized hospital, which will take between 2 to 3 months, where you can do heart surgery. You can conduct any major surgery. You can bring in doctors from around the world. You understand? Now, you see Ghana, every year they bring in doctors to conduct heart surgery in Ghana. So they have a hospital that is well equipped. Doctors only come with their luggages, stay there for 1 month, conduct heart surgeries, and then they go back. What the government does, or the hospital does, or the ministry screening of all of those cases, and then prepare them, give them schedule, and then they can conduct the surgery for them. We need to also do that. We need to take either the Emory Hospital or the 14th Military Hospital, or even some part of JFK Hospital, you understand, and equip it so that it can be taken care of. That same money should also be able to support our doctors because doing the surgery is one thing. But to make sure to manage that particular case until that case is okay is another process. So training will be in that same amount of money. Then the next thing is that we should start taking in the first place those that are available now, those emergency cases that are available that can be treated here now, because we don't have the capacity. We need to start taking them out immediately from this national budget.
Obadiah Johnson from Front Page Africa newspaper. Two major concerns. The national budget comes with competing priorities. Where should this 10 million comes from? Taxpayers' money or donor funding? That's one. The second one has to do with, you previously served as the chairman of the Senate Committee on Health during the government of ex-Liberian President George Manawia. Why now are you trumpeting this goal? Do you think you'll succeed?
Well, for the point of correction, I was not the chairman on health. Okay. We have Senator Kuma, who was chairman on health at the Senate committee.
You're part of the committee.
I was member of the committee. I'm bringing those issues now because we are overwhelmed as a country. I have been bringing in equipment here from 2008 to present. I have been supplying hospitals. As we speak, I have about 4 medical containers, 44 containers at the port that I'm processing to free. And then I'm taking those things to various counties. So we have been doing that. But we are overwhelmed, and the permanent solution is to get the money from the national budget. Is to make it a law, a policy, that look, we need a special need funds every year in the national budget, where that money will go toward equipping and empowering hospitals. You understand? We can start one now in Monserrado. Gradually, you can take another one to Bon County. You can take another one to the Southeast. You understand? What is happening in Southeast with cases where that can be treated in Liberia, and those individuals are in Southeast lying down, only waiting to die because none of the hospital can help them. You understand? We are not just talking about Monserrado, we're talking about the entire country. There are cases as we speak that can be treated here. These individuals, you know, I have been in a crisis, in a situation between life and death. When you are at a point, or when you ever get at the point where you feel to yourself you're coming to die, it's a difficult period for yourself. You understand? So we as government officials or as a government, we should feel the pain of those individuals. Those little children who were that came at the hospital. What is happening to those that are in the community that haven't been diagnosed? But out of the 12, you got only 4 living. These 4, if nothing is done from now to January, they're going to die. You understand? So we need those emergency funds kept aside as a government. It is not a response to have a hospital that is well equipped to cater to our needs. You know what I'm saying? It's a responsibility of national government. And this is why I'm saying, let's put a special funds aside, empower, equip, train doctors, Liberian doctors that will take care of those cases. The next thing is, need money to start taking those cases to work along with other countries to make sure that they go through those treatments and then they can come back. What we want to see is that you are gathered and somebody, 1 or 2 patients is brought back and said, oh, during the special need fund that was set up by the legislature, here is few of the cases that have returned from surgery. You understand? We all will be happy over that. So I want all of us to support the idea, and I want to use this time to say thank you so far to our healthcare workers, because with the little they have, you see how far they have gone. What we need to do now is to empower them, equip them, and support them so they can do more. Thank you so much.
Thank you.